Good afternoon, everyone. I want to thank Guillaume Morgan and the OncoAlert Network for the opportunity to present today the results of our analysis entitled Association between Risk-Reducing Surgery and Survival in Young BRCA Carriers with Breast Cancer, an international cohort study that was published today on Lancet Oncology. As we know, cancer risk management strategies, including bilateral risk-reducing mastectomy and risk-reducing salpingo-oophorectomy, are recommended in BRCA healthy carriers. However, in BRCA carriers with prior history of breast cancer, additional challenges should be considered in the counseling regarding risk-reducing surgeries, especially among young patients. Furthermore, no prior studies focused specifically on the role of risk-reducing mastectomy and risk-reducing salpingo-oophorectomy among BRCA carriers with prior history of breast cancer at a young age. This lack of evidence further complicates the counseling of these patients regarding risk-reducing surgeries. The BRCA-BCY collaboration, it's an international multi-center hospital-based retrospective study that included BRCA carriers diagnosed with prior breast cancer at the age of 40 years or less, so a young population of BRCA carriers with breast cancer. In this cohort of patients, we aim to investigate the association between risk-reducing mastectomy and risk-reducing salpingo-oophorectomy with overall survival. We did 5,290 patients, of whom 2,910, 55%, underwent risk-reducing mastectomy after prior breast cancer, and 2,782, the 52.6% of the patients, underwent risk-reducing salpingo-oophorectomy. In these patients, we observed that risk-reducing mastectomy was associated with significantly better overall survival compared to patients not undergoing risk-reducing mastectomy, with an unadjusted hazard ratio of 0.65. For the risk-reducing salpingo-oophorectomy, it was associated with significantly better overall survival compared to patients not undergoing risk-reducing salpingo-oophorectomy, with an hazard ratio of 0.58. For considering the disease-free survival, the first disease-free survival events, the patients undergoing risk-reducing mastectomy and risk-reducing salpingo-oophorectomy more than halved the risk of developing second primary breast cancers and ovarian or fallopian tubal cancer. So the patterns of disease-free survival events are in line with the expected reduction in the risk of developing breast and ovarian cancers. In conclusion, in our large international cohort of young BRCA carriers with prior history of breast cancer, we observed that both risk-reducing mastectomy and risk-reducing salpingo-oophorectomy were associated with improved overall survival. And our findings are important for a tailored counseling of this unique patient population on the cancer risk management strategies. I want to thank you for the attention, and you can download the full paper from the link below.